deal to end the shutdown, if passed, addresses federal workers, SNAP benefits. It would still leave millions of Americans without health care insurance. Now, the deal would push any congressional decision about Affordable Care Act subsidies to December, leaving those trying to enroll in limbo. Let's go to our Kelly Vaughn joining us right now with more on that. And Kelly, you have information from tax experts that have been looking into this. What advice are they providing this evening?
Well, Larry, they reiterate that without those subsidies, the cost of the Affordable Care Act insurance plans could skyrocket in the new year. And now President Trump is floating an idea. He's suggesting that we take the money for those subsidies and give it directly to Americans' personal health savings accounts. In a post on Truth Social, the president says he recommends Senate Republicans take money currently being sent to insurance companies and instead send it, quote, directly to the people so they can purchase their own much better health care.
Giving them access to an account with some money in it is sort of like giving somebody a 5-foot rope for a 10-foot hole.
Sabrina Corlett is the co-director of Georgetown University's Center on Health Insurance Reforms. She says the extra money isn't very useful without underlying insurance, which millions of Americans could lose if Affordable Care Act subsidies aren't extended.
Half of them are small business owners or work for small businesses. They're farmers, they're gig economy workers. They're basically folks who are out there working for a living, but for whatever reason, their employer doesn't offer them health insurance.
She says without the subsidies, their monthly insurance premiums could double, in some cases even quadruple. The Congressional Budget Office has estimated that close to 4 million people would become uninsured as a result.
In the insurance world, we call this a premium death spiral, because as the premiums go up, more healthy people drop their coverage, and you sort of get into this vicious cycle year over year of healthy people leaving, sicker people trying to hang on, but the costs going up for everyone each year.
In the proposed bipartisan deal to open the government, Republicans have agreed to a Senate vote on the subsidies next month, though the House has made no such promises. Corlett says those trying to figure out their health care plans should be aware of those looking to take advantage of the policy uncertainty.
Bad actors who will try to sell people what is essentially garbage. And they use very deceptive marketing tactics to make people think something is real insurance when it is not.
Now, she tells me despite all the uncertainty right now, she doesn't want people to wait to enroll in their marketplace plan. She says, well, she's not optimistic, but if the tax credits are extended, they will be applied to those who qualify, even if you've already enrolled in a plan. Now, as we mentioned, the Senate's promised their vote on the subsidy extension by the end of the second week of December. That's if their bill to reopen the government passes. Larry.
All right, some good information, so folks should move quickly. Thank you so much, Kelly. Again,